Good morning, Mrs. Julie. How are you doing today? I am glad for your visit and for your interest in contraception. My name is Mrs. Nancy Chinier. I am also a licensed midwife. I would like to know your knowledge on contraception, so that I will have a baseline information and also know the area I will talk about before you adopt a method.
Good morning, nurse. I don't really know much about contraception. The only thing I know about it is that it prevents pregnancy. So I will like you to explain everything you know about contraception. Will be glad, Nurse Nancy.
Good. Contraception is the use of medicines, devices, or surgery to prevent pregnancy, or simply a way to prevent pregnancy, just like you said. Although some contraceptive methods offers protection from sexually transmitted infections, like the use of barrier method, while some others helps prevent menstrual cramps. So we can say that contraception is a birth control method, or family planning.
Thank you, Nurse Nancy. How does it work?
Different methods work in different ways, but in general they all work to prevent sperm cells from meeting the ova, when they meet, pregnancy starts, or conception starts. Some methods are more effective than others, but I will discuss that as we proceed.
Why is contraception important, Nurse Nancy?
Good question. People choose to use contraception for many different reasons, but these are three most important ones. With contraception, it reduces pregnancy-related risks. Research shows teenage girls and their babies are at much higher risks of problems in pregnancy. With contraception, it prevents them from having babies until their bodies are fully able to support pregnancy. Please, I am not encouraging premarital sex. I am a Christian. Ha 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 ha. It also reduces the risk for abortion.
Thank you, nurse. I'm listening.
Pregnancies that are less than 18 months apart have higher risks for both mother and child. So with contraception, couples will be able to plan their next pregnancy when their baby can get the best care before and after birth. Contraception also enables couples to plan their future, because with contraception they have babies by choice, not by chance. This will allow them to follow their education and career goal uninterrupted. Also, with fewer children, families are also able to invest more on each child. As you have seen, our present economic situation, having unplanned children will worsen the situation.
You are right, Nurse Nancy. Please, who can use contraception?
People of any age can use contraception. However, not all methods are equally good for everyone. What works best for you might not work for your friend.
Okay.
Before I proceed to talk about the methods, let's consider this important things before choosing the right birth control for you. Efficiency. Does it requires the least amount of work and thinking from your side? For example, injections and the intrauterine devices used are amongst the efficient ones, as you don't have to worry about contraception for an extended period of time. Another thing you consider is age and health conditions. For example, high blood pressure, obesity, headaches. Age above 35 years, weak immune system can make some contraception unsafe for you. Then you also consider the reversibility and return of fertility. The possibility of having children sometimes later is entirely your decision. For example, if you consider getting pregnant so fast after contraception, you don't have to go for injectables, because you have to be patient for return of fertility. Then if you think of getting pregnant again sometime in life, you don't have to go for a method that will completely remove your chance of getting pregnant again, like sterilization.
Thank you, Nurse Nancy. I don't know about this.
Let's not forget lifestyle and personality also is a determinant factor. If you are a forgetful person going for pills, you have high contraceptive failure. Then let's look at the side effects. Different methods can have different side effects, like headaches, heavy flow, no flow at all, breast tenderness, weight gain, more cramps, no cramps at all. You can experience none or few. Their intensity can vary depending on your body type and health conditions. If you have multiple sexual partners, the use of condoms is advised. Now let's look at different contraceptive methods. It can be grouped into primitive and modern methods. Primitive methods involves those methods adopted primitively, that is in the past before the introduction of modern methods. Such methods are abstinence, prolonged lactation, coitus interruptus or withdrawal method, extravaginal intercourse, postnatal douches.
Okay, can you explain more on the primitive methods?
That's okay. Coitus interruptus or withdrawal method is still a common practice world, but not 100% effective. Its effectiveness depends on prevention of ejaculation on the vagina and male control over ejaculation. Postcoital douches is equal to that of unprotected sex with high risk of infection and should be discouraged. Prolonged lactation. This involves delay of ovulation postpartum while breastfeeding, but not effective as ovulation has been known to occur early in breastfeeding mothers. Abstinence is highly effective but difficult to adopt among couples. Let's look modern methods. Let's look at the rhythm method or calendar method, which involves the avoidance of coitus during fertile period, which requires predictions of ovulation. Intravaginal methods, which includes the use of chemicals, and mechanical or barrier methods. Spermicides are substance that can kill sperm cells. It comes in a foam, jelly, cream or suppositories, or film. You can put it into the vagina near the uterus. It can be used alone or with barrier methods.
Okay, Nurse Nancy, can you talk about the barrier methods?
Barrier methods create a barrier between the sperm and the ova so they can't meet and cause pregnancy. They are vaginal diaphragm, cervical cap, male and female condoms, and contraceptive vaginal sponge.
Any other method, Nurse Nancy?
Yes, there are intrauterine devices which could be medicated and non-medicated. They all have a local contraceptive effect on the endometrium, prevent implantation as well as endometrial inflammation. It is highly effective and have a shelf life of 5 years and duration of action of 12 years. It can also be used as emergency contraception after an unprotected sex. Its side effects include bleeding, pain, expulsion, pelvic inflammatory disease, perforation of uterus.
Nurse Nancy, I don't like this one. Any other method?
Yes, there is normal contraception like oral pills, which could be combined oral contraceptive or mini pills. There is also injectables, which are depomedroxyprogesterone acetate that has a shelf life of 3 months. And narcisterone enanthate with a shelf life of 2 months and others. Then implants that's of implanol, jadal and others.
Okay, Nurse Nancy, I am happy you are creating awareness on this because I don't know about it.
That's okay. Let me talk about sterilization. This method involves vasectomy and tubal operations. Before this method can be done, issue of permanency need to be discussed with you and your partner. Informed consent, and that's his to be for 3 counseling sessions to be sure that the couple have made their final decision. There is also emergency contraception, which involves the contraception taken after unprotected sex. It could be hormonal pills within 72 hours of unprotected sex, or the use of intrauterine contraceptive devices after 5 days.
Thank you, Nurse Nancy.
Any question?
Yes, Nurse Nancy, if I adopt the intrauterine contraceptive method, will the device get lost?
No, the uterus is an enclosed space, so the intrauterine device can't get lost.
Okay, thanks. Let me adopt the intrauterine contraceptive method.
Alright, lie on the couch. Let me prepare for the procedure.